Welcome back. One of the most perplexing problems of COVID-19 is the virus attacks people in so many different ways.
Yes, some have no symptoms. Others end up, as we just saw, on a ventilator fighting to survive. Joining us now, Dr. Kevin Izard, president of Cream City Medical Society. We appreciate you being with us this afternoon because this is something that I know is near and dear to your heart. You've been talking about trying to mitigate this virus. You've seen some patients early on in the pandemic, but you say recently things have gotten a little better. Tell us what you're seeing right now, Dr. Izard.
Yeah, I think it's a testament to the fact that people are, at least they have been, observing the social distancing, staying home when they can, staying 6 feet away, wearing masks. I think it's working. And I hope that that's one point that we get out of all of this as we start to open, that we don't forget that those were important steps that we took. And that's the reason why we're not seeing our system overwhelmed with a number of cases. So we need to keep that in mind, that even as we open, we need to continue to do the social distancing and staying home when we can.
Dr. Izard, why is coronavirus so unpredictable? I mean, we just heard from Leah Blomberg, who wound up on a ventilator, had to learn how to walk over again, while Kitty Genslin, 11 days later, she was on the mend taking walks around the neighborhood again. Why is it so different?
Well, that's the $64,000 question. We don't know why. We know that certain people that have pre-morbid conditions, so things like high blood pressure, diabetes, asthma, that they're more prone to having complications. So they're more prone to end up in the ICU. And if you think about it, if you're in the ICU in an induced coma for 9 days, your body really starts to degenerate pretty quickly. Your muscles weaken. And when you wake up 9 days later, you're not just going to hop out of bed and start walking around. You're going to need physical therapy. You also got to consider, too, that that's pretty traumatic, too. A lot of people they're literally on death's door. And not only that, they're alone a lot of times because their families can't come in, and they might be talking to their family on an iPad or through a window. And, that's traumatic. And so we're starting to see the mental health toll that this is taking on people. People developing post-traumatic stress disorder and things like that.
Yeah, I'm glad you mentioned that, Dr. Kevin Izard. Unfortunately, we're out of time, but that PTSD is a real thing. We're seeing that all over the country. Dr. Kevin Izard, we know these are very busy times for you, and we really appreciate you taking a few moments to join us today on our 5 o'clock show. Thank you very much.